everyone, and welcome. My name is Arvin Jenab. I'm a naturopathic doctor at the Samueli Integrative Health Institute. Really grateful to be here today to share some information about active prevention, which is the title of my talk, Active Prevention, How Addressing Early Warning Signs Can Decrease Our Risk of Developing Chronic Disease. Now, this topic is important to me because as a naturopathic doctor, I'm always working with patients to try and improve their health outcomes. And although it's easy to work with disease, I find it much more meaningful and appropriate to work before disease begins. So I want to define active prevention for you, at least how I see it. So I describe active prevention as the mindful observation of signs and symptoms that present early, a comprehensive assessment of these symptoms in the context of the whole person, and finally, the implementation of targeted treatment strategies aimed at correcting dysfunction and enhancing specific physiological and metabolic pathways in order to optimize health. So we'll go over some of the details of this in the next few slides, but before we do, let's look at why this is important. So why is it important that we actively prevent disease? Already, we've implemented in medicine preventative measures. So we know healthy living and setting a foundation for health is really important. We also know and have developed multiple tools to detect disease early, which is an important part of preventing disease and its complications. But why is active prevention important? Well, let's look at this. The problem of chronic disease is not going away. If we just look at the stats, and I've only sampled a couple of stats from the CDC, the Center for Disease Control, we can see clearly that obesity rates in the United States are the highest amongst all developing and many undeveloped countries. On the right side, you'll see the incidence of diabetes in the United States, and you'll see that over the last 3 decades, diabetes has progressively increased in our population, now affecting 29 million Americans, or 8.3% of the US population. What's more striking is the number of pre-diabetic patients, which is a real eye-opener when we start looking at what's the potential for chronic disease or the potential for diabetes is in the future. We have 86 million Americans, which equals 35% of all adults that are currently pre-diabetic. This is as of 2010, and we only expect that the numbers have increased since then. And with a rate of 5 to 15% per year progressing to develop diabetes, we can expect that this chart will only look more grim when we come back to it 10 or 20 years from now. Another really important reason why we need to look at active prevention is what we've learned when we look at the economic burden of chronic disease. This diagram shows you the current expenditure on health. And when we look at the United States, we see right here that the United States has the highest expenditure on health, again, in the developing world. But when we look at life expectancy, the United States ranks the lowest of all of the countries. And that's really important. This is placing excessive burden on our healthcare system, despite some of the advances that we've seen in medicine. As a nation, our healthcare spending, 75% of it is on patients with chronic diseases. 7 out of 10 deaths of Americans each year are from chronic diseases. And in 2005, slightly outdated, but the latest I could find, 133 million Americans, that's almost 1 out of every 2 adults, had at least one chronic disease. So you can see that the problem of chronic disease is real. It's causing or placing undue stress on our healthcare system, as well as affecting or impacting the quality of life for our population. There's good news here, and the good news is that when they looked at disease models and preventable disease models in this case, what they found was a significant number of diseases could be prevented should we take appropriate measures. So in this diagram, the study showed that up to 60% in men or up to 40% in female, cancer can be prevented if certain health measures are taken. And if we look, the most striking here is coronary heart disease, as well as diabetes, where up to 90% of the diseases could be prevented if we implement healthy lifestyle or healthy diet into patients' routine. So with that, I'm going to start introducing a couple of concepts so that we can delve a little deeper into what active prevention is. So to fully understand and appreciate the concept, I wanted to introduce to you this illness-wellness continuum. So I want you to pay close attention. On one end, we have high level of wellness, that's in the blue. And on the other end, we've got illness or premature death as disease progresses from health to disease. What's important here is to note that disease and health are on the same spectrum, each at one end of the spectrum. Now, we've mentioned prevention, and prevention is really a way to prevent disease from occurring in the first place and maintaining a high level of wellness. This could be foundational steps that patients take to stay healthy. It could be active lifestyle, healthy diet, healthy attitude, and so on. We're all aware of treatment, and treatment is really focused on treating diagnoses so that patients can be brought back to some level of comfort with respect to their symptoms or their illness. In active prevention, what we're really focusing on is the early identification of symptoms or signals, which then can be used to target treatment and push patients more towards the direction of health. Another concept that I want to introduce here is what's referred to as the general adaptation syndrome. This concept was developed by Hans Selye, a medical doctor and researcher, and was originally used to describe how individuals adapt to stress, and now has been applied more to disease as well. When we look at the general adaptation model, what we're seeing again is a spectrum from good health to bad health or exhaustion. And what's really important to note here is that good health or homeostasis is where we feel our best. And in response to a stressor, we react or enter what's called the alarm stage. In this stage, we may experience acute or transient symptoms. As we progress through the different stages, we move from stage 1, the alarm stage, into what's called the resistance stage. This is also referred to as the adaptive phase. And in this phase, what we see is that there are potential warning signals that start to present. The reason it does is in this adaptive or resistance stage, this is where our body is maintaining homeostasis in response to various stressors or influences that can cause disease. However, in maintaining homeostasis, it's using up a lot of resources, it's using up nutrients, it's using up various activities or maintaining various activities in the body so that it can function in its comfort zone. But over time, you can appreciate that with progressive adaptation and increased use of our resources, we move towards what's called the exhaustion stage. And this is often where symptoms and eventual chronic disease will develop. Now, I'll explain this a little bit more with an example in the next few slides. But just to recap, homeostasis in the alarm stage, when we're exposed to an influence that can cause disease, we may experience acute or transient symptoms. As we progress to adapt and our body attempts to maintain homeostasis, there's a potential for warning signals to start expressing. And over time, if we're not responding to those warning signals, the body will continue to progress into what's called the exhaustion stage, which then leads to symptoms and eventual chronic disease. I want to bring attention to the first 2 stages. This is where we can recognize early symptoms and implement treatment strategies to prevent disease from progressing and chronic disease from manifesting or developing in the first place. So let's look at this stage 2. When we speak of recognizing early warning signals to prevent chronic disease, we're really speaking of this stage right here. We're trying to understand how is the body communicating to us so that we can recognize dysfunction before it becomes disease. So let's look at what that looks like. So what do we mean by warning signals? Well, if we're in our car and we see lights flashing, it's really easy for us to know that there's warning signals indicating that we need to service the engine soon. And most of us would respond to that by taking the car in and taking care of whatever this warning signal is indicating. In our body, it's a little bit more difficult to identify these warning signals. So I hope that as we go through the rest of this presentation, you'll start to understand what warning signals can look like, how to identify them, and what to do if you start to notice warning signals. So warning signals in the context of health are signs or symptoms that suggest that a certain function in the body may be compromised. They can be subtle, such things as bloating, fatigue, sleep difficulty, weakness, mood changes, changes in weight, appetite, thirst, or bowel movements. Or in some cases, they can be a little bit more pronounced, such as joint pain, inflammation, high blood pressure, dizziness, migraines, anxiety, or depression. And I included one of my favorite quotes here, which states, "To the blind, all things are sudden." And this is a quote by Marshall McLuhan, who's a Canadian philosopher of the 20th century. And I like this quote because it really has a high impact. To me, it suggests that it's so important to be mindful, to be attentive, to pay close attention to early indicators before things progress to become, in this case, disease. So to the blind, all things are sudden. So I hope with this presentation, what we're doing is opening your eyes to the subtle changes that our body is going through and the subtle messages that it may be expressing so that you can take action before you develop disease. So let's take a look at some examples. And here I want to start with blood sugars. I noted earlier, diabetes is an important disease and a growing concern for the American population. Now, diabetes is, as most of you already know, is a disease that affects our blood sugar regulation. And so I want to start by just introducing you to what a healthy blood sugar chart looks like. So blood sugar generally is between 80 milligrams per deciliter to 120. That's so considered the normal range. In some cases, blood sugar may spike a little bit depending on what we might eat or what we may experience. For example, in case of high stress. We can also see in some instances that blood sugar will drop down, and that can happen if you're skipping meals or not eating enough, or again, in some cases, in response to certain metabolic changes or functions in the body. But the goal really for our body is to maintain a stable blood sugar that's within this range and give us energy and sustenance and make sure that our body and our organs and our systems are receiving adequate nutrition throughout the day. So before we develop or anyone develops diabetes, the body communicates with subtle hints as to whether or not blood sugar is effectively regulated. So let's go to the next slide. And here what I'm showing you are the early warning signs of blood sugar dysregulation. Now these symptoms present in almost all of us at some point or another. Even if you don't have diabetes, even if you don't have blood sugar disorders. This can happen if you skip a meal, if you eat a high carbohydrate meal where your blood sugar might go up quickly, but also crash fairly quickly. So when I go through this, just think about yourself and think about some of the symptoms that you experience and see if you can relate to some of these. So some of the warning signs and symptoms of blood sugar dysregulation include sweating, hunger, of course, with generally an increased craving for sugars or carbohydrates, headache, blurred vision, tiredness, and in some cases paleness, dizziness, trembling, and mood changes. Now, these are very common. Most of us experience these, as I noted. What's less common and less noticed by patients are some of the nighttime symptoms, and they can be mistaken for other conditions such as insomnia. So nighttime symptoms can include night sweats. It can include insomnia. It can include irritability upon waking, as well as morning headaches. Now, this is really important. I often in my practice, see patients who are experiencing sleep difficulty at night. And after taking a careful history and having a conversation and asking patients to monitor their symptoms, what we find is that they may be eating dinner early. So by 5 or 6, they're having their last meal. If their last meal is predominantly carbohydrates, they might be getting a sugar spike right after that meal with a sort of response or reactive hypoglycemia, which means a reactive drop in blood sugar in response to insulin that spikes as well. And as a result, patients end up with low blood sugar overnight, and that affects their sleep. They may wake up between 2 or 4 in the morning, or they may wake up in the morning with symptoms such as irritability, tiredness, headaches, and so on. So let's look at a few ways that we approach blood sugar dysregulation. So when we're talking about recognizing early symptoms or signals, what's really important is to know what to do with it, how to measure them, and how to apply treatments that are targeting or addressing the dysglycemia in this case, or the imbalance that we're evaluating. So one of the first things we look at is the blood glucose chart. So we know that the range we talked about, and blood sugar could be increased, it could be decreased. And one of the ways that we can monitor this is not just a random fasting blood sugar, but in some cases, measuring postprandial blood sugar response, which means measuring blood sugar response or blood sugar in the blood in following a meal over a period of time to see how well the body is regulating blood sugar. What we're evaluating for also is insulin resistance. So fasting insulin levels could be an early indicator that the pancreas is working harder to try and manage blood sugar. So as an early indicator, as a provider, I'm looking for not only whether fasting serum glucose is affected, but also is fasting insulin levels, are they affected as well? And if insulin levels, fasting insulin is starting to rise, that could mean that it's taking more insulin from the pancreas to have the same impact on the blood sugar. And that could potentially over time lead to a pre-diabetic type scenario. We're also looking at things like hemoglobin A1C, which gives us a 3-month window into the blood sugar regulation in our body. Hemoglobin A1C is a really effective way to measure whether or not the body has been able to regulate blood sugar over the previous 3 months. And so we measure that every 3 months to 6 months in patients who may be affected by blood sugar dysregulation, so that we can sort of actively or proactively optimize their blood sugar regulation. But in addition to that, as an integrated provider, we're also looking at other systems that may be involved. So we're looking at this from a whole person context. We're looking at, okay, is liver health, which is involved in metabolism, is that implicated in the patient's blood sugar dysregulation? Another organ or system that's important is the thyroid. We're looking at thyroid hormone levels to also, again, identify whether the thyroid gland is involved in the patient's experience of dysglycemia or hypoglycemia. We're also looking at stress. We know that stress plays a really important role in how we utilize blood sugar. And if patients are experiencing stress and blood sugar dysregulation, then an early approach to treatment, would be to address stress, normalize stress, continue to measure or monitor blood sugar before moving forward to address blood sugar more directly. And we have tools such as various specialty tests that will help us identify dysfunctional cortisol curve in this case, looking at cortisol levels throughout the day. And we know that with elevations in cortisol, there's increase in blood sugar that can impact blood sugar regulation over time if it continues to sustain. Another tool in it that we have access to is what's referred to as body composition. The body composition essentially is using a special scale, in this case, the in-body scale, which is measuring visceral fat to identify risk of not only weight gain, but also the pattern of weight distribution in our body. It's looking at the pattern of weight and how it's distributed in our body, because that has implications on insulin resistance. So we need to know, for example, that increased abdominal fat is associated with increased risk of insulin resistance. And we see this diagram here from a study in 2020, which took a close look at this and was clearly demonstrated that with increasing body fat, visceral fat specifically, both in men and females, insulin resistance was increasing in proportion to the amount of visceral fat in the body. So what we're looking for is, over time, working with patients to decrease visceral fat. And by doing the body composition measurements, we can monitor and also target exercise as well as diet to ensure that patients are meeting their goals and achieving those outcomes that we set out for them. Another example of a system that presents with early indicators is the cardiovascular health. The early indicators for cardiovascular health are very common. Most of you would recognize these immediately. So blood pressure changes, low or high, this is really important. If you find yourself in moments where your blood pressure is spiking, so you have hypertensive episodes, or if you're finding yourself with drop in blood pressure at times where you're feeling lightheadedness or even faint, well, that's really important. That tells us that the blood pressure is not regulating itself as efficiently or effectively as it needs to. We're looking at circulation. So poor circulation, for example, could be an indicator that consists of things, symptoms such as cold extremities, numbness and tingling, or skin changes such as hair loss in the extremities as a result of poor circulation. Irregular heart rate, if you notice that your heart rate is irregular or you skip beats, or your heart rate can range quite a bit from, say, low in the 40s all the way up to 120s. Or in some cases with exercise, you might find that you experience exercise intolerance where heart rate goes up, but has a difficult time coming back down. Excuse me. Shortness of breath, water retention or edema, sleep apnea, erectile dysfunction in men, as well as cognitive changes. These can all be early indicators that the cardiovascular system is being implicated or affected, which may lead to future chronic disease affecting the heart. Again, here I'll share some advances that we use as integrated providers in terms of assessing patients. The goal again here for a provider or for a patient is to identify these signals early. So we have lab tests that are specifically designed to identify various aspects of cardiovascular health. These are the advanced cardiometabolic tests. Some examples are the Boston Heart Diagnostics test or the Cardio IQ. We also have access to nutritional assessments where we're looking at nutrient profile or nutritional status to be able to identify whether there's specific areas we can target to support cardiovascular health. Other diagnostics that are really interesting that we use at our clinic is the EndoPAT. EndoPAT essentially is a way of evaluating the vascular system. It's looking at endothelial function, where by identifying vascular changes or endothelial dysfunction early on, we can take active steps and targeted steps to correct vascular health so that there's less stress on the heart. HRV is another really great example of a tool that can identify symptoms early prior to them contributing to chronic disease. In this case, or in this context, HRV, which stands for heart rate variability, is a way of evaluating the autonomic nervous system. The autonomic nervous system essentially is your sympathetic and parasympathetic nervous system. And by looking at the nervous system's role in regulating heart rate, we can identify the role the nervous system is playing in potentially driving disease. So if there's early signals that are suggesting that the autonomic nervous system is not being effective at regulating blood pressure and heart rate, then we can take steps to support the nervous system prior to it becoming a more serious disease. Zeo patch is a way of monitoring heart rate over a period of time. One of the nice things about the Zeo patch is that it's worn on the body, it's worn for 14 days, and during that time, it can give us some important clues as to what may be contributing to some of the symptoms that you may be experiencing. For example, if a patient experiences symptoms, heart rate changes, then they can monitor or mark the life event that may have triggered that symptom. And that's really important because part of active prevention is to be mindful and to be aware of how things impact your health and to be able to identify life events or daily events that translate into symptoms and actually chart those for your provider to see. That gives us some important clues on how we can best support you so that we can normalize heart rate over the course of working with you. And another last one here is the sleep study. And sleep study, again, we're learning that the quality of our sleep has a direct impact on many different health outcomes, including obesity, hypertension, and fatigue. So a sleep study is again, an early indicator. If there's difficulty with sleep, it's an early indicator that there's potential risk factors for chronic disease to develop in the future. All right, so moving on, what I want to do is bring it back to active prevention and just remind you once more what we mean by active prevention. So remember that active prevention is not just prevention. Prevention as a general statement is foundational. So to prevent disease, we all support a healthy foundation as the base. Early detection is not prevention. However, early detection helps us prevent disease complications in the future. Active prevention, which is what we're focusing on, is the strategic and targeted measures taken to prevent disease based on a whole person assessment of risks and active monitoring of symptoms and outcomes. And this is really important. Let me highlight a few things here. It's strategic because we're being strategic based on what we've come to know about your health. If you have blood sugar that's not regulated well, then we want our preventive efforts to focus on regulating blood sugar and taking that stress off of your pancreas, your liver, and your body in general. It's targeted, which means treatments are being used to target specific physiological or metabolic functions to reverse the course of disease. And it's whole person based because we're looking at the entire person's health and influences that are impacting their health. For example, blood sugar dysregulation is not really just a problem of blood sugar. Blood sugar dysregulation could be a problem that needs correcting at the level of stress, at the level of the thyroid gland, at the level of liver and liver health. It could also be diet and lifestyle as well. And the last highlight here is active monitoring. And again, this is really important. This is where we rely heavily on our patients. Active monitoring of symptoms means paying attention to symptoms over the course of days, weeks, months, or even years to note what are the influences that are impacting your health and how are these targeted treatments influencing or improving your health so that we can measure those outcomes and confidently support you in achieving your desired health goals. So where do you start? We've talked a little bit about what active prevention is. We've talked about a couple of examples where early detectors or early signals can help predict the course of disease. And by paying attention to those early indicators, we can take active steps to prevent disease. But where do we start today? What can you do to start this process? So the first step is easy. The first step is lay the foundation for health. Live mindfully, maintain a healthy diet and lifestyle, minimize stress and conflict in your life, maintain a positive outlook and attitude, connect with people in nature, make time for yourself, and live life with purpose. All right, so the second step is listen to your body. If you've ever worked with any integrative providers, you know that we rely heavily on how you listen to your body and the symptoms that you share with us. Our visits are longer. We take a fairly thorough history. And with that, what we're doing is soliciting information from you that help us identify early indicators so that we can target treatment to support your health. Some examples of areas of function in your body that are important to listen to include the digestive system, everything from appetite to elimination, what you eat, how you feel after or the next day, your mood, be mindful of your mood, including time of day, tendency for anxiety or sadness, irritability, anxiety, lethargy or worry, sleep, any difficulty falling or staying asleep, energy on waking, sleepiness during the daytime or symptoms that occur at night, heart rate and breath, so noticing changes in both of those, especially in response to stress or mood changes, and pain, be mindful of pain and inflammation in your body and factors that either make it better or worse. And then lastly, be mindful of such things as your memory, weight changes, food cravings, circulation, and joints, for example, joint stiffness or muscle weakness. Now, to make this easier, know that you've all received a copy of this wellness journal in your bags, your virtual bags. So make use of it, take notes, practice listening to your body and see how that works for you. Next time you go in to see your integrated provider, bring this book with you and share this information with your provider. Okay, third step is take advantage of the new medicine. A growing number of providers and clinics are shifting their focus to health promotion and disease prevention by paying attention to the expression of metabolic and physiological dysfunction before it becomes disease. This is really important. This is the kind of doctor that is exploring and investigating these subtle changes in your body function to identify ways to support you and actively prevent disease. In addition, what we know and are seeing is a growing number of tools and resources that are available to assess how your body is functioning and for us to hear the subtle signals. And some of those I shared with you when we talk about blood sugar as well as cardiovascular indicators. These are diagnostics that can pick up changes in function before they become disease. Okay, so what is the take-home message today, from my talk at least? So the take-home message is, while maintaining a healthy foundation is important for preventing disease, through active prevention, you and your provider can recognize the early signs and symptoms that signal that some function in your body is compromised or is in distress. Subsequently, strategies can be implemented to optimize function in order to reverse the course of disease and shift the trajectory back towards health and wellness and away from disease and premature death, if you go back to that spectrum that we shared earlier. I hope you enjoyed this talk and I look forward to answering questions. Thank you.